Hello, our viewers. Thank you for joining us today. My name is Alex Ainembabazi. A lot of young girls out there are faced with a lot of challenges when it comes to accessing sexual and reproductive health rights. Today, we are privileged to have the ADHO of Iganga district, who will be telling us more about these challenges and what can be done. We are glad to have you here,
Thank
madam.
you so much, Alice.
Yes. So we would like you to kindly elaborate more light on what are some of the challenges that are faced in reproductive and equity.
Okay, thank you so much, Alex. Greetings to you all our viewers. The challenges of reproductive health equity, especially for the younger girls, I would start with, I would say, lack of awareness for the girls themselves. One, they are still young. They know, maybe they know they are growing up, they're adolescents, but the information is still lacking. And I would say there's little that has been done to see that these services reach to the schools, because that's where most of the younger girls are. To see that they reach schools and then give them reproductive health information, and then maybe they become equipped with information. Once a girl is equipped with information, that means she's empowered and she's able to be assertive and make her own decision based on the knowledge that she has, that also that she cannot just face the challenges, maybe being lured into something that she is against her will. I would also services of the adolescents have not so much been strengthened. You know, when they are planning for these services, they look at the mother and the child. They look at the general population. But specifying services for adolescents per se at facilities just coming up by training of health workers now in adolescent self-services. But still, at the facility level, we talk about adolescent-friendly corners. But the infrastructure itself does not support the services because it was planned in a way that it's for a general service. Now, adolescent comes in a facility, but she finds all age groups, even people that she looks at as mothers. She will not come out to go to a health worker who is also looking like her mother or her parent and be able to give him or tell her their challenges. So that also becomes, we've not targeted that, although we are now trying to come up with that. Trainings have been taking place actually, schools and whatever, but implementation is still because of challenges of infrastructure, challenges of staffing, challenges of commodities that target the adolescents. And what I would say that an adolescent may want to have a service like family planning, but now you know the challenge which is there. This is a younger girl. We shouldn't give her this information because she's young. We're encouraging her to have sexual relationships when she's still young. And yet, by the time this girl comes, it means already something is taking place. And as you know, adolescents, their fear is mainly pregnancy. And once they come, just that one gives you information right straight away. But when she comes for family planning, she's already active. She has started engaging herself in sexual activity, and now because she doesn't want to conceive and have an unwanted pregnancy, she has come. But when she comes to the facility, maybe the commodities are also not there. Stockouts are there. So she can't get it, but she can't go to a private facility because she cannot afford to buy. And also family support may be a challenge. She cannot tell a parent that I'm going to a facility to get family planning. Or I'm going to a facility because I have STI. It's only maybe she fears, how did you get it? It's only when a parent is a friend to the child. You know, parents sometimes are harsh. And once a parent is harsh, this child, adolescent boy or girl, will fear because they know the parent will ask, how did you get it? Yes. But it's not that maybe all STIs are sexually transmitted. Some of them could be contaminations, knowing that they don't know how protective measures. Maybe they're in school or friends and toilets and whatever sharing things. So there they get challenges, and at school actually they are supposed to have such services also. Schools have like school nurses, school doctors, but they are not there to give these services. They only have a sick day and only attend to the sick ones that are being taken there. But having time that let's have a session of this group of class, like a school have designed. Today maybe the S4A or S3 this, we are going to have a session with the school health team. That one is still a challenge. But these other adults get those services in open and when they, of course, when the adolescents come and mix up, they may not come out openly to also ask the questions, because the other group they are seeing is age, when you look at the age, is not matching. So they will also go with what the adults are saying. So I would say that one, there is no equity still there. There is still a lot that we need to work on to see that an adolescent gets services and also their issues and concerns are addressed. And that's why you're seeing that there is a high number of teenage pregnancies, there are high numbers of unwanted pregnancies, because for them they are going to try, but there is no one who has gone to school tell them, you know, as you try, these are the risks, or if you want to try, this is what you should do to avoid yourself getting either infections like HIV infections or getting pregnant. So I would say that we still have a gap there. Now
you talked about the adolescent corners in the facilities.
Yes. And
which are not yet utilized. Or maybe they are utilized but not fully utilized to some extent. Now, what can be done to make sure that these corners are very much utilized by these adolescents? Because at the end of the day, the adolescent will come, they will not get the service that they want, and they get unwanted pregnancy. Just like you said, young girls fear pregnancy more. You get, so they'll be forced to go and carry out an abortion or something, which can even be unsafe, and then they end up, sepsis. That's how we are going to have the maternal mortalities and all that. So what can be put into place to make sure that at least these young girls are able to access these services?
Thank you so much. I talked about adolescent corners. Actually, they do exist, but there was like challenges of infrastructure and space. You may find that a facility is using a family planning clinic as an adolescent corner. Now adolescent is there, but there is a client who has to move out first, then the other, and also comes. Or an adolescent comes, then the other clients, and they are like, oh no, this one now is seeing that kind of thing that they have seen me coming out of this. They are there, but there are those where there is space. They are there. They attend to them, but maybe the time. Because these adolescents are free mostly in the evenings. Those that are at school, they're at school if they are not in holiday. And from school, that's when they will say, we are going back, and then let's go there. But are the health workers there to attend to them? Yes, they are there, but they may find even this is a health worker who has been working and is tired and has less time to attend to the adolescents. Of course, we want we have like in Iganga, we want we put in specific staff to attend to these clinics. But you may find this is one or two. But when she's not there, because she cannot work 24/7 every day. When she's not there, who is attending to this person? Or if she's sick, who will be there to attend and give the same service? That's why at the beginning I said the issues of staffing are also affecting the services. Because if like in a facility we say these three are specifically for this, but of course this is the staff who handles also the other side of antenatal or clinical side of the patients at the PD. But again, she has also, he has to come this side also attend to adolescents. And if it is a busy clinic day, they may work on them. But I don't think when someone is tired, they can give quality service and have time for, if there are other patients the same person is going to attend to, will have adequate time to give to this. Though we try to tell them and they try, but as a human being, there are others. You may not exhaust exactly the quality that this adolescent needs. Yeah.
Now, when you look at the schools, because I think there is somewhere where I talked about, schools, like students that are in school,
Yes.
they may not be getting this information. Is there something that can be done to ensure that at least these students get the information from school? Because we are looking at this scenario whereby students are more in school than they are at home. And when they come back home, the time they spend with their parents is a bit minimal. So you may find
Sure.
a parent cannot, tell a student that their child do this, do that, do the other one. So could there be something that maybe could be done, like maybe in the school setting, at least help these young people have the information or age-related kind of information?
True, most of the time they're at school. Like I said, this school nurse, school doctor may not have time. But I would say, so like in our district, some schools were trained senior man teacher, but they may not have the technical information all to give to these students. So what I'm saying is, if these schools can plan with the facilities, so that the medical team, in a month at least, the teams go to the schools for purposely school health. I would call it school health. Looking at giving them information, we're organizing with the school at least every week or month, depending on either facilitation time and capacity for them to reach the schools. Because the school is a big institution with different classes, different age groups. But I would say if in a week a group goes there, maybe this week we are handling this class, the other week we shall handle this group, the other week like that. And then after the talk and giving them that information, the team also goes with some of them, maybe like kind of treatment camp, because some of them may be having issues there and they need services, but they cannot go to the facility or they will think it is something small and yet the infection is what? Is growing. That's what I would love to see actually happening. And that's what we are planning. We are trying to emphasize to facilities to have that out of the routine outreaches. Let them designate one outreach, which is for immunization, and also with the Kalito PHC, let them designate at least a day to the school and be able to give this health information to the students.
True. Thank you so much for your information and for your time.
You're welcome.
Well. So that is what is happening, especially with the young people, and it's actually a lot challenging when it comes to the young people, because even when they go to the facilities, it is very hard to access what they are going in for. It is very hard to get these sexual and reproductive health services, as well as when it comes to the rights, because most of the times the people out there are adults and these are young people, so they are shy. They don't know how they are going to come out and say something. How are they going to look at me saying this and the other one? So it is a bit challenging, but yes, we would like to also know or hear from you or have your views. What do you think can be done for these young people? This was the view from the ADH of Iganga district, and thank you so much for being here with us.